Yes, Sitaram, and good morning, and welcome again to part two in this series of program on addiction and recovery. This morning, we have been looking at early childhood trauma and its relationship with drug addiction. This is sometimes or very often overlooked, even in recovery circles. We believe that, we just help the person to stop drinking the alcohol or using the marijuana or the cocaine, and the problem will be solved. And a lot of people would be happy with just that. And that is a good start. But if we do not look at the predisposing factors, these other factors that might perpetuate the person's drinking or drug use, then his sobriety recovery becomes precarious. So, what early childhood trauma has a well established and powerful relationship with drug addiction. Now, decades of research in psychology, neuroscience, and addiction science show that adverse experiences in the early life can shape brain development, stress response systems, and coping behaviors, often laying the groundwork for substance abuse later in life. What is early childhood trauma? Again, early childhood trauma refers to distressing experiences before the age of 18, especially during critical developmental periods. And these include physical, sexual, or emotional abuse. It also includes neglect, deprivation, you know, because a child, for instance, who is going to school with no shoes or without books is unable to finish their homework because of what's happening in their home, the fighting between the parents and so on. All of these will eventually impact that child's self-esteem, which would later on predispose them to drug addiction. Witnessing domestic violence, loss of a parent or caregiver, parental substance abuse, or mental illness. I many years ago on this program, I've been doing these programs since 1993 on various media houses. And I have often, every time I look at uh, this whole question of parental substance abuse, it triggers in mind an experience, I had personally when I used to be a social welfare advisor, and I had to go visit these clients who receive public assistance. And I remember I was working in the Pinal, San Francisco district. And I don't want to identify anyone in particular, but there's this family who are getting public assistance because the head of the household was certified as being ill and unable to earn. And when I visited, I saw the wife of this man packing a bag, you know, quickly, and she was hurriedly doing things. And I asked her, "What are you planning to leave?" And she described to me what happened. She says every Friday or every time he goes out the road, and I know he's going to drink, we have to go through this whole process where she packs a little bag with, milk powder for the baby and little clothes for the little girl, and then there's a little boy just about 6 years old and a girl about 4 years old, and the baby. And they have to now, she has to throw this bag outside and leave it in the back because when he comes through the front door, she will have to pick up the children and run to some neighbor. And a lot of times when he comes in and they get into fights, these little children are looking at these two parents who are supposed to be taking care of them, actually in their mind at each other's throat, trying to kill each other. And this little boy of 6 years old is getting between them and trying to part the fight. And I want our listeners to pause a little bit and imagine that scenario. The little girl is sitting in a corner, wetting down herself, you know, with fear. She's so scared that she's, defecating. What is happening in the minds of these children? What is going to happen? And there's a lot of literature now on the adult children of alcoholics, how they are affected. They are not allowed to be children. They have to take a parental role even when they were a child. Here's the situation with them, and the fear that is engendered in that. And a lot of times they can't go by this neighbor because he went and tell the people house. So they can't even tell anyone where they're going to be rushing for rescue later on. When you have grown up in a situation like that, it takes a terrible, terrible toll on the developmental state of a child, on their emotions, on their ability to cope. And as I said in a previous program, pathology breeds pathology. These same children who suffered because of their parental alcoholism only find that they themselves end up using drugs to help them to cope with all the fear, the mistrust, the anxiety, the depression, all the psychological symptoms that they would have to face with later on in life. And they also become stunted. They are afraid to get into relationships. These will be the children who become very, very efficient managers and all of that. But they suffer because they have difficulty forming relationship, sustaining their marriage later on, and so on. And there's a lot more could be said, but I want to continue on listing some of these early childhood trauma that could set the stage for drug addiction. Living in extreme poverty or unsafe environment as well can also, not that poverty leads to drug addiction, no, but because of the deprivation, it can. And different family, the upper class, the middle class, and so on, they tend to have a stronger social network. They have a better chance at life chances in terms of getting a job and getting an education and so on. So that poverty in itself, a lot of people have said, poverty in itself is a crime. So these are all things. And what I'm saying, it may not be your fault that you are not as rich as some people, but if you have these situations, it means that you need to be mindful. That is what this program is about. It's about educating you so that if you know that you have conditions that you have little or no control over that would put you at risk, then you have to be mindful that your children are not, or you are not, adding to that, enabling that situation by drinking yourself or using drugs, or giving your enabling your children to continue to do it. Now, these experiences are often measured by tools like the Adverse Childhood Experiences, which is called popularly the ACE score, which correlates high trauma exposure and increased health risks, including addiction. Now, how does trauma affect the brain and the body? One is trauma can disrupt brain development. Trauma affects key brain regions like the amygdala, which deals with fear and emotion regulation and so on. It also affects the development of what is called the hippocampus. That is the memory, that part of the brain that deals with the memory and retaining things and so on. And also affects the development of the prefrontal cortex, which helps us to control impulses and it helps us to make decisions and all of that. So if our brain is being affected by our experiences in terms of how we deal with our emotion and we deal with feelings and fear, and it also affects our memory, retention, decision making, then it is common sense that we can see where it will eventually affect our general quality of life so that we would be less able to cope with challenging situations in the future. And if introduced to drugs early, or if we see our parents and the people around us using alcohol and so on, which in this society, we don't need a reason in Trinidad and Tobago to drink. Almost every social occasion, It is expected, as though we don't even know, and I could identify with that. How can you have a good time without drinking? I have stopped drinking now. It's 41 years and a few months. And I can tell you, I've been to several occasions, family occasions, and only recently I was away attending a wedding in New York. And if there isn't drink, there's no function. Actually, it seems like people can't enjoy themselves without drinking. There's that belief. But I, who was sober, I was able to sing, dance, do everything, and really enjoy the occasion and appreciate it sober, because whatever a man can do drunk, he can do better sober. So coming back to the brain development, you know, drugs also alter what is called our stress response. Chronic trauma deregulates the hypothalamic pituitary adrenal axis, leading to what is called hypervigilance. It leads to anxiety or depression. And these are some of the things, when I worked in the field, I worked at Cora Hospital, we would see a lot of patients coming in who would have started using the drugs to help them to cope with anxiety and depression. And I'm here not only talking about the illicit drugs or even the alcohol, which is illicit, and the prescription pills. I am seeing more and more young people coming to me in my practice here who, suffered a bout of anxiety because of being jilted in a relationship or facing, with poor, low self-esteem, and poor coping skills, would have ended up at the psychiatrist now presenting with insomnia or depression or anxiety and a whole range of things, psychiatric conditions, and prescribed with psychotropic drugs, only to find that they're now using the psychotropic drug. And when they develop tolerance to these sleeping pills and all of that, tranquilizers, they start supplementing it with alcohol because the alcohol is right there in the house in the bar. And it's okay to take a drink. They see their parents doing it. And now we have a double whammy, a problem here, where they are addicted to the psychiatric drug. And now they've also become dependent on the alcohol and the marijuana and the other substances. And yes, the marijuana and the cocaine and all of those are scapegoated in this society because of the stigma associated with it. But the parents and siblings have no problem with, if you just take the medicine, they would say, not realizing that a sedative is a sedative. Alcohol is a sedative, just like the sedative that you were prescribed by the doctor, and the body is unable to discriminate which is which. Both of them cause the same thing. So that I am seeing a lot of people who are getting into trouble because of their drinking and other drug use, but who have also at the same time become dependent on psychiatric drugs. And a lot of them will tell you, and the doctors will they will report that the doctor said, you'll have to take this drug for the rest of your life, that you can't stop taking it. And every one of us know that once you start taking a drug, you develop tolerance. At first, where 2 milligrams will put you to sleep, now you have to take 5, and then 10, and then 15, and then 20. And over the years, I have had patients here who have to have people running around to various drugstores to buy prescription drugs, sleeping pills under the counter, which is illegal, but a lot of things go in this country. So these altered stress responses lead to something called hypervigilance, as I mentioned before, anxiety or depression, and chronic stress and inflammation. Drugs may be used to self-medicate this constant internal distress. So once you start using it, what happens is when you use it, you feel good. You get a high, you are able to sleep. But when it is wearing off, whether it be the prescription pill or the alcohol or the cocaine or the marijuana, the person goes into withdrawal. And withdrawal is very painful. Withdrawal, there's a whole long list of symptoms that you experience when you are in withdrawal. Of course, the problems for which you are using the drug returns, the anxiety and depression, and returns more severely, but you suffer with additional problems now. You have uh, tachycardia, the heart is racing, you feel anxiety, body pains all over, you feel things are, you're losing your balance. Some people start hearing voices, and a whole lot of very scary withdrawal symptoms, including insomnia and irritability and all of those things. So that the person, even though they have sufficient insight and realize that, look, I need to stop using this drug, they are unable to do it because of the pain that they experience whenever they stop. So it's like the drug, speaking to you, telling you, don't even think about stopping because you know what will happen. And so the siblings and the people outside say, but I can't understand. This boy comes from such a good family, went to school, is so educated, was always a bright kid, well-intentioned, and look how he's not even taking care of himself. And he's stealing things in the community to get money to buy his stuff. He's hanging out with people who are literally vagrants and all of that. And you can't understand how a person like him could become like that. And it is because of what I'm describing here this morning. Now, trauma is a pathway to drug addiction. Many people who use drugs are not doing so to get high anymore, but rather to numb the pain, calm the anxiety, or escape the memories of, a lot of people who start using drugs. And this is one of the things that we need to pay attention in recovery circles and treatment facilities. They engage in risky behavior. They start policing that they start going out with, you know, men will go out with prostitutes and women will prostitute themselves in order to get the drug. They engage in risky behavior, which would put them at risk for physical illnesses as well as um, STDs, as we call them, sexually transmitted diseases and all of that. But they also get into behaviors like stealing, driving under the influence, that can lead them into problems with the law. And now a whole career, once you chalk up a conviction against you, your whole career could be put on the line. Your whole life will turn upside down. And then that leads to more trauma, more depression, and of course, more aggressive use of the drugs in order to cope. Now, opioids may reduce emotional pain, but as I said, you get temporary reprieve. But when it is wearing off, the emotional pain is still there, the problem is not solved. And in the meantime, under the influence, you might have gone and done some additional things that could put you at odds with people around you or in your community. Stimulants may help counteract depressive states, but again, whatever goes up must come down. That's the law of nature. And alcohol may provide a temporary escape from hyperarousal or intrusive memories. For the time being, you become euphoric after a few drinks. But when it wears away, what happens? You don't even start from where you were before you started to use the drugs. Now, of course, this process is called self-medication over time, and it rewires the brain's reward systems, increasing dependency. And I'm not a brain surgeon or a doctor in that respect, but I've worked in the field of psychiatry for many years. I worked at Ward 8 in Port of Spain, at St. Anne's Hospital, Ward 1 in San Fernando. And I have seen too many of these cases of young people who are there now who have become addicted and dependent on drugs. The statistics that highlight the connection between trauma and drugs, it is as follows. Individuals with 4 or more ACEs, that is ACs are 5 to 10 times more likely to use drugs and 7 to 10 times more likely to become addicted. About 2 out of 3 people in substance abuse treatment report significant early trauma in their lives. Women, in particular, with childhood trauma, are at especially high risk for using substance abuse to manage emotional pain. Now, men generally, well, this is changing now, but generally, even now, men have a lot of other outlets that they can ventilate their emotions and so on. They go drink, gamble, they play sports, and all of those things. Women are now starting to become more and more involved in these activities, sporting, football, cricket, and all of that. But not nearly as much as men. And then we also know that women have a lower tolerance level for alcohol, where a man could probably take a good few drinks and still manage, to get along and get home and all of that. Women, um, their body metabolism doesn't allow them to metabolize as much alcohol as rapidly as men, and they have a tendency to get drunk very quickly. And we all know of, you know, men using that to an advantage, to get girls drunk and they go to parties and there's date rape instances and so on. And it is something that a lot of people are aware of. It is not. Now, before we close, I know we keep reaching to that time when we have to close the program, but I want to speak a little about healing and prevention. There's what you call trauma-informed care, treatment models that understand and address trauma history rather than just stopping drug use. And these are much more effective. And that is what I do in my practice here. A person don't just stay like that overnight and become an alcoholic. There are antecedents. There's a story that led to that. He wasn't born that way. And although he may be born, that or she may be born in a family with a high incidence of alcoholism or drug use, my role as a counselor is to also look at what other trauma this person would have encountered in their early childhood development, because these would be those factors that will continue to perpetuate the desire to use drugs even when they have stopped. And this is where Alcoholics Anonymous has been found to be especially effective and helpful, because in the AA program, there is what is called step 4 and step 5, which is very therapeutic. In step 4, the person is required to take a moral inventory of themselves, of all the things that they would have done wrong, all the trauma they would have experienced, how it affected them, and how it continue to inform their decisions, their trust or mistrust, their fear or confidence in later life. And then there's, of course, step 5, which provides a cathartic experience where you are able to ventilate these things and desensitize them. So that there's also in therapy, there's what you call eye movement desensitization and reprocessing. And there's cognitive behavioral therapy. These are also methods that is used, intervention methods in counseling and psychotherapy to assist. There's somatic therapies and mindfulness approaches. These therapies help process trauma and build healthy coping skills. Mindfulness is what we also know as meditation. Of course, the people in the West, when you hear the word meditation, the first thing you think about yoga and a particular religion, Hinduism, and all of that. And a lot of people find that a little bit unpalatable. So rather than say yoga and meditation, we say mindfulness, which is about the same thing, which makes a person. I myself practice meditation and mindfulness, and I can tell you from personal experience has helped me to become more aware of what is going on in my mind, so I could take evasive action at the thought level. As a thought come in my mind, I become aware of it. I can look at it and say, hey, where am I going to go with this? From past experience, I know this would lead to conflict. It would lead to being judgmental. It would lead to fear or some kind of emotional turmoil. And I'm able to deal with it there rather than translate it into action. And of course, in future programs, I will be speaking a little bit more about this. So if there's anyone out there who might have experienced early childhood trauma, you need to be mindful if you are now introduced to or is using psychotropic drugs like tranquilizers and all of that. You need to be mindful of what you're doing because it can lead to a dependence later on. And if it has already, if you have become dependent on these things, then I want you to know that, look, you're not broken. I have been helping hundreds of people here in my practice to come off psychotropic drugs. I'm not telling you to stop it without the advice of your doctor or getting professional help, but to become aware that if the body does not discriminate between whether this mind altering substance was prescribed by a doctor, psychiatrist, or by the shopkeeper or the pharmacist. The body is affected similarly and can lead to dependence. And to become dependent on any drug or any substance is setting yourself up for problems later on because dependence and addiction are progressive. They don't stay static. They don't get reversed. And here, before I leave, is a little bit confusing. A lot of people, I hear old people saying, but a long time I used to drink a lot, now I just take 2, 3 drinks. Well, it is not that the person's drinking has improved, but it is because the tolerance level has fallen. They are not able to handle very much without getting drunk and inebriated now because their body is weak and their liver is unable to handle it and all of that as they used to in the past. So that all the more reason they need to stop. So if you have listened to the program this morning or any part of it, you think that you can benefit from this, of course, my numbers are listed here. You can call and help is available. In Trinidad, we are very fortunate. We have the treatment facility at Cora Hospital. We have Alcoholics Anonymous that is very prevalent. We have the most AA groups up to now, more than any other country in the world. And it is giving help free of charge, And there are thousands of people who are being able to come off drugs and do better with their lives as a result. So all you have to do is call. The numbers are on your screen. You can call me after the program, 671-3040, or you can text me at 768-5925. You can call the radio station. They have been giving the numbers as well if you need additional assistance. And of course, you can go to my YouTube channel. You type in Addiction and Recovery, Ramnaresh Dwarika, my name. And there's a whole list of programs that I've done over the years that are posted there on various aspects of alcoholism and drug addiction. And you can view them yourself, or you can refer it to someone who you think might be able to benefit from these discussions, the information given, because this is especially useful because this is a disease of denial. People who are alcoholics and drug addicts, they don't really care to openly admit they have a problem, but I want to let them know that help is available, and this is one way you can look at it in your own time. And there are meetings online now that you can access even without having to physically present yourself at an AA meeting. So I want to thank all of you who are listening and thank the radio and television station, Radio and TV Jagriti, the management there, for allowing us free time, free radio and television time as a community service for all our brothers and sisters out there so that they can benefit from the content of this program. So I want to thank you all again for listening. And remember, next week, Thursday again, we will be on Same time, 9 a.m. to 10 a.m. And if you have questions, you can post it on Facebook and my YouTube channel, and I'll be quite happy to respond to it there. Or you can call me at 671-3040. So thank you again for listening and joining me this morning. And remember, the program is going to be repeated tonight again at 10 p.m. So thank you, Sitaram, and goodbye.